Welcome to the National Retiree Legislative Network podcast, produced by and for America retirees and those over age 50. I'm Bill Kadereit, president of the NRLN and your podcast host. If you're listening to this podcast, go to NRLN.org and click on the NRLN videos and podcast color-like icon in the middle of our homepage. Select episode number 6, view the video and tables and charts, or click the podcast audio. At NRLN.org, you can also click Contact Us tab on the taskbar and select Contact the NRLN. Send us an email or call 866-360-7197. Offer your comments, questions, and suggestions. In Episode 6, we will apply information and tools used in Episodes 2 through 5 to help you choose a Medicare Part D prescription drug plan or enroll in by December 7th. Table 1 is a Medicare Plan Enrollment Resource Guide that might help you find information in prescription drug plans. In all examples, you should use your Medicare and You handbook and also access Medicare.gov and the Plan Finder to create a personal account and load your personal prescription drug list, then get premium, deductible, annual drug costs, etc. using the Plan Details feature for your plans. You may be considering extra plans that are effective in your state and zip code. If you're signing up for Original Medicare and or Medigap plan, or if you select a Medicare Advantage plan without a Part D prescription drug plan, all you'll need is the Medicare and You handbook and go to Medicare.gov, where you can use your Plan Finder and select a Medicare Advantage plan that includes a Part D prescription drug plan. You will also need to make sure your drug list is compatible with the Part D plan that you choose. The formulary is there to compare with. If you are in Original Medicare or Medicare Advantage plan and want to switch plans, or want to drop or switch your Plan D prescription drug plan, you will need your current plan annual notice of change and make sure you compare the latest information with other plans. And you will also need to make sure your drug list is compatible with the formulary of plans being considered. Also make sure to consult the Medicare plan switching rules on page 74 of your Medicare and You handbook. You have over 5 weeks until December 7th to decide. Don't let a TV commercial or salesman rush you into a decision. Get fully informed and prepared before you decide. In Episode 5, we talked about how health risks and the out-of-pocket maximum in Medicare Advantage plans are important in reaching a decision to enroll. But out-of-pocket maximums are not included in Plan D plans, so that's not a concern here. Personal health risks, however, are important because Medicare Advantage drug plans may not cover the full coinsurance cost of Part B drugs needed to treat life-threatening and serious chronic illnesses. Part B drugs provided by hospitals, doctors' offices, and medical facilities everywhere are administered by doctors and are not included in Part D drug plan coverage. About 70% of all Medicare Advantage plans offer drug plans, and most are apply taxpayer rebates to reduce Part D plan premiums, deductibles, and copays. We use the Medicare Plan Finder to collect Part D plan details on Table 2 to each of the Village's Florida Medicare Advantage plans that we used as examples in Episode 5. The last 2 columns were left blank, so 2 more sets of plans data can be added to expand the number of plans being compared. A 30-day supply of drugs was loaded into the Plan Finder, including blood pressure, statins for cholesterol, and a blood thinner. Drugs required to treat a typical chronic disease. Your total cost might be 50% or more lower. If less expensive drugs were used, but also could be much higher in other situations. So it's important to add your specific list of drugs to your online My Medicare account if you want to see estimated annual information on plan details. Part B drug coverage not covered by Plan D is shown on the last 2 rows of this table. They're there in red font to demonstrate how costly it can be without a Medigap G plan that would pay for Medicare Advantage copay and coinsurance costs shown for these three plans. You can see that the PPO plan is for 50% for out-of-network clinics or hospitals that administer such drugs. Cancer treatment costs could cost you thousands of dollars if the 25% or 50% Part B coinsurance had to be paid. One of my close family members' cancer drugs are over $10,000 a month. A Plan G plan costing $166 a month in the villages would save 25% or $2,500 a month. That's $30,000 a year, and would be 15 years worth of the premium of $166 a month. So Medigap G can be very handy in areas where you have high value drugs. Another real example is a villager who could afford Part D insulin, but now cannot afford the insulin pump that goes with it. The insulin pump is carried under Part B and is very expensive. Copay costs for drugs included in our 6-drug profile demonstrate how high-tier drugs can cost more unless covered by a Medigap plan. See the $45 or $95 copays in Tier 3 and 4 in red font. Higher cost drugs push you into the coverage gap sooner and cost a lot more while you're in it. The most helpful data in the plan details is shown here on Table 3. Premium and deductible costs adjusted by rebates applied are shown on the first 3 rows. Premiums and deductibles for all 3 plans are paid for with rebates, except that the $150 deductible remaining in the PPO plan, in red font, was $395 before rebates paid $240 of it. The data on the middle row in red font are both calculations of drug and premium costs for the 3 villages plans. In this case, and in most cases, there's very little difference among plans. It's normal to see that when the list of drugs is the same for all plans being compared. Variations are small unless rebates are applied, and that happens mostly in the Tier 1 and Tier 2 category because generics are cheaper than brand drugs, and insurance companies want to use rebate dollars there so they can set low-ball pricing on generics that bait retirees into buying Medicare Advantage plans. Since this portfolio of drugs was more expensive than a healthy person's average portfolio, you can see on the last 2 rows in red that the coverage during the gap stage will be reached in April or July, and that you don't leave the gap until January of the next year. So you must assess your personal health risk before deciding on coverage. Ask your doctor or pharmacist about lower cost alternative drugs, including generics. Episode 8 will be a podcast but with no video, and will cover prescription drugs and the NRLN's white paper. NRLN's Ed Beltram, VP of Communications, who authored and annually updates this NRLN proposal, will join me to discuss this important topic. Read the white paper at nrln.org. Click the Legislative Agenda tab, then select White Papers, and then the white paper called Reduce the Price of Prescription Drugs. If you have questions or comments, get them to us as soon as possible, and we'll try to address them in the podcast. Now, the NRLN is your source for the truth about retirement benefits crucial to your future well-being and the financial well-being of your children, grandchildren, and our country. Stay current with news that affects you through our emails and our website at nrln.org. There you will find the links to follow us on Facebook and Instagram. Click the NRLN video and podcast icon again in the middle of our homepage and select a podcast episode or video. On the NRLN taskbar, click the Contact Us tab and then Contact the NRLN, where you can send an email or call 866-360-7197. Ask questions, offer suggestions, offer new topics, and sign up to get our NRLN messages, action alerts, and advance information about future videos and podcasts. Until next time, stay safe out there and enjoy your life. Seniors are special.